Hey PUDM, for those of you who don't know me, my name is Megan Anderson. I'm a May 2025 Purdue School of Nursing graduate and a PUDM alum. I was a fundraising CM for 2 years and then a fundraising chair for 1 year. And after I graduated this past May, I started my nursing career in the Riley Maternity Tower NICU in July. So unfortunately, I do have to work tonight, so I'm not able to be there with you all, but the lovely stewardship ladies sent me some questions and some topics that I can talk about with you. The first question was what makes Riley so special for patients, for families, and then also for staff. So the first thing that I think really comes to my mind when I think about what makes Riley special is their dedication to patient and family-centered care, which is really basically exactly what it sounds like. We just want to make sure that our patient is at the center of their specialized and specific care and treatment that we are giving them. So we do that in a lot of different ways. One of the really big ways is rounding every morning. So basically for rounding, the patient's care team, which will be doctors, nurses, maybe sometimes pharmacy or social work, nutrition, therapy, they get together and they come to the patient room and they just talk about the progress so far, things that have been going well, things that maybe need to be improved on, things that we can add to the treatment regimen to help the patient get to the best outcome as possible. This is also the time for the patient and their family, if they're present, to speak up and have their input be brought into the conversation, maybe make some requests. And this is just like a really great collaboration opportunity because we're making sure that all sides of the story here are being told and being met so that our patient can get better, get healthy as soon as possible. That collaboration is also super important because it helps the patient and their family feel heard and like their voice matters, which it absolutely does. But that just helps build trust and a relationship between family and our healthcare team, which also improves outcomes. Some NICU-specific patient-centered care items would be private rooms. Not all NICUs actually have private rooms for each baby, but this is super important, especially because a lot of our parents like to stay the night, so it gives them a private space to be able to do so, and it also just makes them feel more comfortable in a big hospital, and it makes them feel like they have somewhere to go to bond with their baby. We also have NICU view cameras, so they're just little cameras that we have over each baby's bed, and then the parent has an app on their phone that they can go on 24/7. Cameras are always on, and if the parent is at home taking care of other kids or maybe they're at work, because a lot of parents aren't able to just drop their entire lives to be in the hospital with their kid, they're able to just go on there and they can see their baby in live time. And I think that that's like a really big support item for parents to know that even when they're not able to physically be with their child, they're able to check in on them and know that they are safe. Riley is also a great teaching hospital. We always have new doctors and physicians coming in to complete their residencies or their med school roundings. Also, just like personal experience, the nursing residency program is really great. I have a class about once a month where I meet with other new grad nurses from different units, and then even on I have online classes too. On those, there's new grads from other IU Health hospitals, so I'm getting to talk to new grad nurses from so many different specialties about things that have been going really well for them at the start of their careers, maybe things that have been a struggle, and then we can kind of compare and contrast and give advice, and that's just really cool. It's a very supportive teaching and learning environment for sure. Riley was also recently once again ranked in 11 out of 11 pediatric specialties, with 3 of them actually being ranked top 10, which is so super cool. As an employee, that just really validates your work. Even as a new employee, it makes me want to work hard to uphold that legacy that Riley has built for themselves. And then for, I think, patients and families, it just makes them feel like they can trust the care that they're getting, and it makes them feel a lot more safe. The next question was about my favorite part working with patients and families. And being in the NICU, my patients being babies, they don't talk to me, obviously. I talk to my babies whenever I go into the rooms, but most of my actual interaction is with their parents, which I really love. I love being able to connect with my parents and building a relationship because I feel like it makes them, trust me more. They get to know a little bit about me. And when they have to leave the hospital, they know that there's still someone there who cares about their child and is going to do their best, make sure that they stay healthy and get better so that they can go home soon. I also think a lot about the phrase change kids' health, change the future. Whenever I'm going into a patient room, I just kind of like to think like what this baby is going to grow up and do one day. And I feel like that's just really cool because of the care that we are able to give, a lot of because of fundraising like you guys do. A lot of these kids are able to live really long, happy, healthy lives that maybe they wouldn't have years and years ago. And because of that, they're going to be able to hopefully make a really big impact on the world. Sort of going off of that, another question was something that I wish more people knew about kids with chronic or long-term illnesses. I think that the big one is just to know that there's still hope in these diagnoses, that these kids can have a long and happy life and they can have a good quality of life. But a lot of that is because of funding that leads to research, that leads to finding treatments and cures, medications that can help these kids feel better and be better. I guess I would also want people to know that these families who have kids with long-term illnesses are probably some of the happiest, most grateful, and appreciative people that you will ever meet. Having to experience and cope with something as, kind of depressing almost and hard to manage and accept, it really changes their outlook on life. And so just talking to them and hearing how they do manage that and cope with that and how they've had to alter their thinking is really inspirational, and it makes you want to appreciate your life more and not take it for granted. I also want to talk a little bit about fundraising. I know that a lot of the money that you guys raise goes to Child Life programs at Riley, which are an amazing program. They make these kids feel so much more comfortable being in scary situations. If they are going to have a potentially painful procedure, they'll have Child Life come in and they'll bring toys or a tablet for distraction. And that makes such a difference in these kids' care. It makes the hospital experience feel, it's still not like super comfortable, sure, but it makes it feel a lot less scary and a little bit more familiar and comfortable. And that honestly makes everyone's job a lot easier. When the child is compliant and comfortable, we can give a lot better care. For NICU, it's a little bit different because babies already don't really have awareness of their surroundings, but we still offer pain management for these procedures. We'll have mobiles, like a mobile that goes over a crib. There's some toys that we can put in, sound machines. We also have car seat grants that are for parents who can't afford to buy their own car seat for leaving the hospital. So we offer them a car seat for free. Another big ticket item that this money goes to is research. So Riley really values research, which I think is so super cool. Another NICU specific thing, we've had teams do a lot of research on high flow jet ventilation and then surfactant administration, which is basically a respiratory support system and then a medication that we give to the baby's lungs. And both of these just help the babies breathe easier, faster, have better oxygen saturations, and improves their outcomes a lot faster, helps them go home faster. And from these results, we've been able to share them with other hospitals. And then we have babies getting better all over the place, which is obviously awesome. And a lot of that is because of funding that people in programs like you guys do. So thank you. The last thing that I wanted to talk about a little bit was my why and how it has changed since joining PUDM to now working for Riley. When I joined, it was for my sister, who was a Riley kid, and after joining, I got to hear from so many Riley families. I got to hear from my friends about their whys, and so I was already kind of creating this network in my head of all these amazing and positive stories that I've heard from Riley. And that was a big reason why I decided to work there. But now I just have a million new whys. I meet a new one every time I work. I have a new patient, a new baby. I meet a new family. I hear about a patient from a different unit. It's just so inspirational to hear about these really good stories that we have coming out of Riley. It makes me very proud to be working there. And it makes me really proud to have been a part of PUDM and to help fundraise to create these hopes, I guess, for these families and these patients. So I hope that as Marathon is coming up, you guys are thinking about your whys, maybe thinking of making an ask list of some people that you can ask for dono at Marathon. I know that sometimes it can be hard to ask for dono. It can be hard to go do whatever crazy thing you guys might have planned for Marathon to get some donos, but just remember your why you're doing it. PUDM is a super fun time, but we're also doing it for a reason, and the reason is for the kids. So I hope that you guys have a really great marathon. I hope to see you there, and thanks for listening to me.